What is bipolarism? Bipolarism is a mental health condition that affects millions of people every day. The condition goes by several other names, including bipolar disorder and manic depressive disorder. People who suffer with this illness may have a variety of mood disorders. Fortunately, there is help for those with bipolar disorder through medications and psychiatric treatment. Types of bipolarism. Bipolarism divides into two types, bipolar 1 and bipolar 2. Although they're closely related in the symptoms, they each affect people in different ways. Bipolar 1 presents serious symptoms of psychotic behavior. People with this type of bipolarism tend to fall into high levels of manic behavior. Bipolar 2 symptoms are milder than bipolar 1. People may exhibit less disturbing manic behavior. Episodes. Doctors further divide the two types into episodes. Each episode represents certain emotions that influence how people with bipolar disorder behave. They're described as follows. Mania. This stage brings on episodes of manic behavior such as hallucinations or delusional behavior. People may feel extremely happy one minute and very angry the next. The emotional episodes may be dramatic and last for long periods of time. The emotions vary with each episode and cannot be predetermined or placed into a pattern. Hypomania. Hypomania is less severe than mania and doesn't last as long as manic episodes. Hypomania feelings can easily escalate into mania. Some doctors consider it a precursor to manic episodes. Euthymia. Manic symptoms or episodes are non-existent. People may feel more relaxed and resigned in their emotional state. Depression. This stage can accompany both types of bipolar conditions, but not always. It makes people feel sad, depressed, or unable to function in their daily activities. Depression is usually a condition in its own right. It often accompanies other mental health problems such as bipolar disorder. Cyclothymic disorder. Cyclothymic disorder is a condition similar to bipolarism. It mimics the symptoms and signs of the condition and causes hypomania-like behavior. Most professionals consider it a precursor to a full-blown manic depressive disorder. Symptoms and indicators. Each stage has its own symptoms or indicators. Mental health specialists look for the symptoms to determine which stage their patients may be experiencing. Hypomania and mania exhibit symptoms of excessive energy, insomnia or the need to stay awake, invincibility or the feeling that nothing can stop them, or that they're the leaders of the world. Feelings of promiscuity, increased agitation and anger, excessive spending, unrealistic thoughts and ideas, and religious rantings. Euthymia symptoms and indicators include mellow, good attitude, calm, and feelings of happiness. Depression symptoms and indicators. Lack of interest in their activities, work, family, and friends. They choose to avoid interacting with others and may also consider suicide or have suicidal tendencies. Lacks good hygiene such as forgetting to bathe or brush teeth. Skips work or calls in sick for several days at a time. May show very little interest in job duties while at work. Causes. Although it's not exactly clear as to what causes the disorder, it generally appears during the adolescent stage of life or in the early teens. Healthcare specialists, scientists, and others who study or work in this area of mental health contribute many factors to developing bipolar disorder during these ages. Some even consider heredity as a cause. People with family members who have the problem may develop it as well. Other specialists contribute the chemical imbalances within the brain as a cause. Neurotransmitters in the brain affect emotion and mood changes in people. If these transmitters become damaged or disrupted, people may not have control over how they feel or react with others. Diagnosis. Diagnosing manic depressive disorders typically begins with recognizing and analyzing the symptoms and indicators. Parents usually are the first ones to notice changes in their children. Teachers may have concerns about a child's disruptive behavior in the classroom. Doctors may refer parents to trained psychotherapists in order to properly diagnose their children. Adults with bipolarism may require different methods of diagnosing the condition. Since many adults were not properly diagnosed when they were younger, doctors look at their current behavior to make a correct diagnosis. Most adult patients look for assistance during the depression stage. They can receive mental health referrals to qualified psychotherapists for treatment. Psychiatrists and psychologists will talk to their parents about how they feel. They may examine their patients' family histories for any indicators of the condition. Specialists must rule out every other mental health condition, such as attention deficit disorder or schizophrenia, to correctly diagnose a bipolar disorder. Treatments. Once mental health professionals make the correct diagnosis, they can prescribe the right treatment. Treatment may include psychotherapy and antipsychotic medication to control mood swings and manic behavior. Doctors may also prescribe antidepressants to control the symptoms of depression. The treatments must be ongoing because manic disorders cannot be cured. Bipolarism is a serious and life-changing condition. It's important for those with the condition to seek and receive help. With the right diagnosis and treatments, bipolar disorders can be controlled.